Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, March 19th. I'll turn things over to Dr. Fitzgerald for an update on the latest numbers. Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have no new confirmed cases of COVID-19 in our province. The total number of cases is now 1,014. There have been 8 new recoveries in Eastern Health, leaving 26 active cases in the province. In good news, one of our recoveries is in an individual who was hospitalized, leaving only 1 person in hospital due to COVID-19. A total of 121,549 people have been tested to date. I recognize that many individuals in the sports community are disappointed that team sports are slower to resume, and I would like to take a minute to explain why that is the case. We know that variants of concerns move faster and easier. In the last outbreak, which was due to the B117 variant, we saw the virus spread quickly through families, social networks, and workplaces. Our case counts were doubling in slightly less than every 2 days. We were fortunate to have detected the virus when we did. We were mere days away from this virus spreading across the province and becoming much more difficult to contain. The presence of variants are quickly becoming the dominant strain of COVID and changing the epidemiology across the country. And this does increase our level of risk. If things continue this way, then the assumption will be that any new cases that enter this province will be variant. And while our travel restrictions are stringent and effective, there are no guarantees when it comes to this virus. The most critical thing for us right now is to keep our contacts low, and I cannot stress enough the importance of this. We cannot ignore the reality that group activities, including team sports, result in multiple contacts for each individual, and this is compounded by the interaction of different teams and individuals involved in multiple types of sports and activities. We recognize the importance of sport and other activities in the health, both mental and physical, of the people who play them, and we recognize the importance of return to play gradually and safely. We are engaging with Sports Association and requesting that they submit return to play plans. These plans will need to look somewhat different than the return to play plans from last year and consider how team sports can resume with reduced contacts in light of variants of concern and epidemiology, not just here, but across the country. We know that vaccines work well in preventing severe illness and death from COVID-19, and while it is our hope that increased vaccinations will also reduce transmission of the virus and improve the epidemiology, it is simply too early for us to know just yet. It takes time for real-world evidence to emerge. So for now, we will have to keep many of our public health measures in place. We will be watching how the situation evolves in the coming weeks to months to see how that can change as we vaccinate more people. We are charged with protecting public health, and we will continue to base our decisions on the most current and best available evidence. These decisions are not made lightly, but in the best interest of us all, with our health and safety always at the forefront. As an update on our provincial vaccinations, we now have over 48,000 doses administered as of Wednesday. The arrival of our shipments of AstraZeneca vaccine means we are now able to provide a safe and effective vaccine to first responders sooner than anticipated. We have designated additional priority groups as candidates for the initial shipment of the AstraZeneca vaccine, and these include border services staff, search and rescue, sheriff's officers, correctional officers, and other enforcement groups who have worked through all alert levels. As a recap for those who may have just joined, we have no new confirmed cases since yesterday's media advisory, and the total number of cases in the province remains at 1,014. We have been incredibly fortunate to have low prevalence of COVID over the last year, and this has allowed us more freedoms than many other jurisdictions. We cannot take this for granted. Following public health measures is our best chance to keep COVID-19 under control in our communities, and it will take our continued determination and discipline. But I know we are up for this challenge, and we've come too far to stop now. So hold fast, Newfoundland and Labrador. Thank you, and hope you have a good weekend.
Well, thank you, Dr. Fitzgerald. What a difference a month can make indeed. Just 4 weeks ago, we had 60 new cases. with a total of 417 active. Today, we have no new cases, with only 26 active. It's a real testament to all of you for your hard work and diligence, and to Dr. Fitzgerald and her team at Public Health. Public health measures may be challenging to live with, but they work. As more and more vaccines roll out, the brighter things become. And here we are now with news of an Atlantic bubble being reestablished, hopefully a month from today, April 19th. This is excellent news for our tourism sector heading into the summer. I know many people within Atlantic Canada are anxious to come home, and many here are anxious to see loved ones. Tourists can't wait to come to our province, and we certainly will welcome that when it is safe. I also want to remind our residents that if you haven't really explored our province, this summer is a great time to do so. Start planning now. Your province needs you, and the ask is simple and so rewarding. Explore this amazing place we call home. Restaurants, shops, tourism operators, B&Bs, hotels, and inns. Your resilience and dedication throughout the pandemic has tested your resolve, and I hope you see this as bright days ahead. Know that we all are here to support you. As we all know, the Atlantic bubble depends on our numbers here staying low, as well as the numbers throughout New Brunswick, Nova Scotia, and PEI. It depends on us reaching alert level 2 safely. We have proven that we can do this. So let's all stay vigilant as we start planning for an amazing summer across Newfoundland and Labrador. With that, I'll turn it over to Dr. Haggie for a few comments.
Thank you very much, Premier. 26 active cases and only one person left in hospital is a good place compared with where we were only 2 or 3 weeks ago, as others have said. My number for today is 48,048. That is the number of people vaccinated as of yesterday across this province. And that is an increase of just over 7,000 since the weekend. So we continue to roll this out. Our limiting factor is and will be for the entire rollout, I think, quite frankly, vaccine supply. We have phase 1 pretty well complete. And we have 50% or more of home care workers already registered. That's the last group that are left from phase 1. Dr. Fitzgerald has referenced what we're calling the level 5 workers, people who are obliged to go to work during level 5, and they will be the broad category under which corrections, fire and emergency services, first responders and the like will fall. We've started with first responders across the regions as of a couple of days ago in the case of Central, and these individuals will be identified to the RHAs by their employers. Excuse me. The next group, or the next groups really, are really the vulnerable, and the vulnerable by age. We have gone through long-term care and personal care homes, and they're done. We have now got people over the age of 70 registered, and over the coming weeks we will start in tranches with the older age groups first. So 85 plus, 80 plus, 75 plus, and then we go down in 5-year increments. If the vaccine supply is greater, then we may be able to do that in 10-year increments, depending on numbers. That we will work through over the course of the next few weeks. As the Premier referenced, contingent on numbers, there is again a very real vision of a new summer, and it's becoming more concrete as the days pass and the good news continues to come through. However, it does depend, as we've all said, on our numbers staying good and as following public health guidelines. We need to follow these until our vaccine delivery, the percentage of the population that are protected, rises to a critical level to allow us to start to tail them down gradually so that they sort of overlap. We go down on one and up on the other. The variants of concern are still out there, and there are new ones that are popping up from time to time, which are potentially very troublesome. But it's only by using our public health knowledge and the advice of Dr. Fitzgerald and her team that we can manage these at the moment. So with that, we need to hold the line on public health as our vaccine numbers increase. With that, Premier, I'll hand it back to yourself.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Dr. Fitzgerald. Yesterday, as we alluded to earlier, it was announced that Newfoundland and Labrador could be re-entering the Atlantic bubble as of April 19th. I was hoping to get your thoughts on this. How confident are you that this can be done safely?
Well, I think, we've done it safely before. People know what to do. They know what to expect. Our numbers are low. Our numbers are low everywhere in the region. So I think if things stay as they are, we can see a way through to do this safely.
Thank you. And just a few minutes ago, the Newfoundland and Labrador Medical Association sent out a press release calling for Eastern Health to address what they're calling vaccine inequality among physicians. They say Eastern Health is vaccinating physicians inside their facilities, but other community-based physicians have not yet been afforded the same opportunity, which they're arguing has not been the case in the other RHAs where community-based physicians have been given that opportunity. I'm not entirely sure who to address this to. Maybe the minister can answer it. What do you know about this situation and why is this happening?
Yes, thank you very much. It's a good question. Physicians, like other frontline healthcare workers, have been vaccinated in order of their likelihood of exposure to COVID. So we are aware that because of historical issues in Eastern Health, there are a small group of community physicians who really have very little connection directly with Eastern Health facilities and emergency services or emergency departments. We will be reaching out to them as part of the level 5 category I alluded to under phase 2. So I think that's an issue that is small in number, obviously one that Eastern Health are now aware of, thanks to the NLMA.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi there, thank you. We know that a couple hundred first responders received their vaccine today. Is there an order now for phase 2 for, say, when teachers or rotational workers will be vaccinated next?
So we're working through those through phase 2 now, and certainly, those are we are having discussions about where we go next with that, and our priority groups in phase 2, obviously. We need to make sure that the people who are at higher risk for severe disease are done as quickly as possible. So that's our first priority. The AstraZeneca vaccine has allowed us to reach out to other groups, perhaps a little faster than we would have been able to, which is really good. And we are looking at, depending on vaccine supply and what we get, who we can offer that to next. So, all of these things are going into consideration, and we'll be reaching out as appropriate.
Perfect, thank you. And so when it comes to the Atlantic bubble, the variants have changed the way we deal with COVID. Would the variant change the Atlantic bubble? Would it look different than how it has in the past for say, new restrictions and precautions?
So I think, in our discussions with the rest of Atlantic Canada, our approach to the borders are very similar in that, we have similar isolation requirements and strict entry requirements. So, that's the main thing with regard to the variants, certainly with regard to contacts and that recommendation of keeping contacts low. We try to remain as consistent as we can across all 4 provinces, and so those are discussions that we'll be having as well going forward, just to make sure we're on a very similar page, if not the same page.
Thank you.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Hello, thank you. Dr. Fitzgerald, with less than 10% of Canada vaccinated now, and of course the variants still circulating, do you think it's possible that Newfoundland could open to the rest of Canada as soon as July 1st?
Thanks, Mark. That's a really difficult question to answer, actually, because we don't know what's going to happen in the next couple of months as we increase vaccination rates, and I think we need to see what will happen. The effect that the vaccination will have on spread of disease. You know, if we start to see that as we vaccinate more people, we see a reduction in spread in some of those provinces that have higher rates of disease, then, you know, I think that bodes very well. But that's information that we won't have until we start to see more people vaccinated. And with 10% vaccinated right now, that's not really something that we would even expect to see on a larger scale, like the reduction in transmission on a larger scale. In certain pockets, we're seeing reduced transmission, perhaps, but you know, we can't comment, you know, sort of at a general population level at this point. So I think that's a long answer to say that really it's only time that's going to tell if we're going to be able to do that.
Thank you. And you mentioned earlier sports. Has it been clearly established that the people, or at least a large number of the people who became infected in that last outbreak, were they actually infected, or were they exposed, I guess, to the virus while playing sports? Is it clear has the link to sports been clearly made?
Yes, so the link to sports has been clearly made in many cases. You know, it's not the only link, absolutely not. There are lots of other, you know, there's links in families, there's links in other gatherings and other activities, there's workplace links. You know, with that number of people, obviously there are lots of other areas where that spread would have happened. What we saw was that it was sort of a jumping off point, right? And then there were so many contacts through the sports that it took a lot to be able to work through that. So so the issue really is, certainly we did see spread through sporting events. We saw spread in other events as well. I'm not trying to say that sports was the only thing, but the number of contacts that we saw with regard to some of the sporting events was really part of the issue that, you know, because what happens is you have an event and you have a number of people infected, but they then take that and go elsewhere, right? So they take it back to their families, or they take it back to their workplaces, or they take it to other sporting events, and then you have another situation where you have a lot of contacts that it can get spread to. So it's just, it's really more that it's a jumping off point, and that's what we got to be careful about. So.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
On Wednesday, the government website reported that 46,000 doses of vaccine had been administered. Obviously, that number has moved a little bit since then. But for the purpose of the question I wanted to ask, I'm going to use 46,000 as a baseline. 46,000 doses administered doesn't mean that 46,000 people have been vaccinated. If you remove the people who got second doses, or got counted twice, if you will, according to the government website, that number is 9,400. So that reduces the number of people who actually were vaccinated to about 36,000 as of the 17th. So my question, Dr. Haggie and Premier Furey, is that earlier this month, when you both seemed to be basking in the bright light at the end of the tunnel, you said you had information that led you to believe that 80,000 people would be vaccinated by the end of this month, which would be a first step in seeing that everyone who wanted to be vaccinated would be by the end of June. And you said that number is 380,000. I hope you're right, but according to the government website, if new doses equals additional people vaccinated, then the week before last, there were 9,000 more people vaccinated. Last week, 13,000 more. And if you up that 13,000 rate by 50%, and we hit 20,000 new vaccinations next week, and then 10 in the balance of the month after that, we still just get past 60,000 by the end of the month. We don't get to 80,000, which was the first step in trying to hit 380 by the end of June. So my question is, do you wish you had been a bit more cautious when you're making predictions and raising hopes earlier this month?
Premier, I can take that if you want.
Sure,
your arithmetic is really interesting, Roger. However, our assumption is that we will have delivered before the end of that period, 80,000 doses. The limiting factor here isn't the process. The limiting factor here is the delivery of vaccine. The reason we can only do 6,000 shots, for example, in the last 3 or 4 days is that's all we have had delivered. We are working on the principle that Pfizer will live up to its obligation to the federal government, and the federal government will continue to give us our 1.4%, which it has done, quite frankly, except on one occasion, back in early February. That's the reason for the optimism. Now with discussions that we're going to get an extra tranche of at least 7,000 initially AstraZeneca doses, courtesy of this arrangement with the United States, and possibly at the end of that, a total of 21,000. Again, all within the next 4 to 6 weeks, according to estimates and planning. That's where our numbers come from. We have a public health vaccination system that is not at all stressed by the load it has on it at the moment. Our challenge is simply getting the vaccine in. And my comments right back from the beginning have been, if we get what we're promised, this is where we'll be. Nothing has changed.
Leslie, that was a really wordy question I asked, so to be fair to my colleagues, I'll pass on asking a follow-up.
Thank you, Roger. Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Okay. Roger must be up there. I was expecting to hear another question. I'm looking to clear up some confusion about AstraZeneca. This arrived in the province last week, but only started being administered, I believe, on Tuesday. Why was there a week delay in getting that into arms?
One of the challenges we had, in actual fact, was simply around getting the information we needed from the emergency services to enable us to identify who we were going to be vaccinating. We'd made the decision to do that. The second thing then was simply organizing this. We have, I think, 240 or 270 volunteer fire departments or fire departments across the province, for example. So the logistics of where to place a clinic and how to do that had to be navigated. So that was part of the challenge. And I think the facts of the case is that we are well advanced on that. And we will get better at this as we figure out what is a better way of dealing with groups like this. Are we better asking them to pre-register, or are we better going through their employer and through their professional organizations? So, we've had some lessons from this. We were running a tabletop exercise within the department today to see how we can make some process improvements for other level 5 workers.
Thank you. And I guess in a way I want to broaden that question, because a lot of people are asking, and I mean a lot of, I get this all the time, if we have a per capita proportion of the vaccines, why does it seem that many other provinces are weeks ahead of us in terms of getting down that priority list? Is there some kind of a proportional issue internally, like the number of healthcare workers, that sort of thing?
Peter,
I think all I can do is speak for Newfoundland and Labrador. Somebody referenced earlier on that 10% of Canadians had been vaccinated. That's pretty well where we are. And it's 10% that are the most vulnerable, because that's where we started. These are the seniors in congregate living. These are our COVID-related healthcare providers. In terms of what happens elsewhere, I think you've got to remember that the numbers that you see from Ontario or Quebec are not going to look anything like the numbers you'll see from Newfoundland and Labrador. I mean, our population who would be eligible for vaccine is around 452,000. We're a small province. You don't see huge numbers delivered in PEI. I think what is more useful for the information of general public is what groups we've done. So we've done all the congregate living for vulnerable seniors, personal care homes, long-term care. We've done COVID units, ER, ICU. We're working out through other acute care providers who work through level 5. We're now into first responders. Once we've done the healthcare, the home care workers, we will have pretty well done all of phase 1, and we'll be coming out of phase 1, I would reckon, by the end of this month. So the numbers only tell part of the story.
Okay. Thanks.
Our next questions are from Danielle Edwards with the Canadian Press. Please go ahead.
Hi, I wanted to ask a little bit about the process behind getting into this new version of the Atlantic bubble, because it seemed initially that New Brunswick, PEI, and Nova Scotia were planning on reinstating the bubble and kind of holding it as a maritime bubble. So I wanted to know how exactly that conversation went and how we've completed now the sort of full Atlantic bubble.
Well, I can take a stab at that. I think it probably happened on 2 levels. It happened on the medical officers of health level, but it also happened on the premier's level. That frankly, when they were talking about the maritime bubble, our numbers were still higher than we would have liked from a provincial perspective. But as they came down, and as you've seen, the steep decline in our new numbers per day and our positivity rate, that frankly we're in an equal position, if not better, arguably, than some of our Atlantic partners. So that's probably how the conversation went at the premier's level. I'm sure you could speak to how it went at the chief medical officer level, Dr. Fitzgerald, but I would assume it was similar. It was based on epidemiology in our own province, frankly, driving that decision.
Mm-hmm. That's correct.
And I also wanted to ask, so sorry, I'm just losing my train of thought. But I also wanted to ask, in terms of vaccine, is Newfoundland and Labrador still on track to meet its deadline of having at least 1 shot in all resident arms by the end of June? That's sort of the what we're hearing from the other provinces in the region.
Yeah, that's certainly our hope and desire and our plan. And again, to echo Minister Haggie's comments, it depends on the supply chain, but that's what we've been led to believe will be a reasonable prediction given the supply chain. And so we're certainly hopeful that will be the case. And it is consistent, as you suggested, with the other Canadian provinces. And as Minister Haggie suggested, the vaccine distribution is based on per capita. So we have a per capita formula, so we have no reason to believe that it wouldn't be the same in Newfoundland and Labrador than the other provinces across the country.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Canada has yet to receive its first doses of the Johnson & Johnson vaccine, and I was wondering though if we could get an update on our plans for that vaccine, if we have a more concrete idea of who will be getting it, what parts of the province will be sending it to, that sort of thing.
No, as we haven't received any information really about when to expect that vaccine, we really haven't factored that into our plans. We need to work with what we have and what we know is coming. So at this point, we haven't really factored in what groups would be getting that at this point.
Okay, and this next question is for the Premier. Yourself and Minister Haggie rejoined these briefings when the Metro outbreak began due to the seriousness of the situation. That situation has calmed considerably since then. So my question is, how do you justify your continued participation in these briefings, given the improved situation and the fact that government is still in a caretaker mode as of now?
Well, I think it's important, again, that the people understand that there is still a Premier and caretaker mode, and we're here to support Dr. Fitzgerald and her team. But you're correct in that the situation has changed, and as you noticed, we've changed the number of briefings, and we're looking at continuing to change that into the future. So, but as I said from the beginning, when we were needed to be here, we would be here, and we'll reevaluate that as we go. I thought it was important to be here today because of the news of the Atlantic bubble. And to support Dr. Fitzgerald and her team as we move forward.
Thank you.
Our next questions are from Ben Cleary with NTV. Please go ahead.
The Premier's Advisory Council on Tourism released its interim report and suggested allowing basically all vaccinated Canadian, any vaccinated Canadian, to be allowed to enter the province as early as April 10th. Is that possible at all? Could that be a reality?
When we say, I think they say Canadians in general, but we will hopefully welcome Atlantic Canadians. But we don't see it as a possibility to right now welcome all Canadians on April 19th. I think that's fairly consistent with not just, my conversations with Dr. Fitzgerald, but the other premiers and other chief medical officers of health within the Atlantic region.
Thank you. And just a kind of a reminder, to enter the Atlantic bubble, we have to be in alert level 2. What does alert level 2 look like?
Probably best for you.
Yeah, so alert level 2, we were there before. It'll be similar to what it was in the beginning. So, if you'll remember when we finally moved into alert level 2, and I don't remember exactly what date that was now, but when we did, we started a little conservatively and our gathering sizes were down, but we gradually increased those. So we'll be looking at something similar and and look at, taking things a bit conservatively at the start and just seeing how things go. And I think, we'll want to be looking at keeping our own personal contacts as low as we can, just to reduce the risk of potential spread of the virus and variants of the virus. In those situations where we may be a little closer, a little less cautious, and perhaps not wearing masks as we would normally, within your close contacts. So we want to make sure that we're keeping those as low as possible. So there may be some slight differences in that regard, but by and large, it'll be very similar to where we started out before.
Thank you.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Yes, for Premier Furey, if we're in caretaker mode currently, and the government is able to make the decision to join the Atlantic bubble, why is it that the caretaker government can't deal with requests from municipalities to move forward on road and infrastructure work for the year ahead?
So two parts to that question, I suppose. One is they can, and they are, and my understanding is the clerk has been talking to the executive director of MNL, and there shouldn't be any delays with respect to that. The minister, I believe, spoke to it this morning and is prepared to speak to it again. So that can happen in caretaker mode to those projects that have already been prescribed earlier, so that's not new expenses. And with respect to the Atlantic bubble, as I've mentioned, there was an urgency to it, and under the convention, it's easily reversible should there be a new government form, so it meets what I determined to be the convention consistent with a caretaker mode.
Thank you. And I'm not sure who to ask this next question exactly, but I guess whoever feels it's appropriate for them to answer, please do. I've been getting questions about dental care, and some people say that it is emergency care for some people, and they wonder when when dentists and their staffs will be vaccinated.
So dentists have been recognized as healthcare providers in level 2, phase 2. So they will receive vaccination throughout that phase, when other healthcare providers are vaccinated.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I don't know if this is a question for Dr. Haggie or for Dr. Fitzgerald, but to follow up on Peter Jackson's question about priorities in the queue and people being confused about things, I'm glad to know I'm not alone. Police officers are being vaccinated in the eastern region now, but people who are in between 70 and 80 are not. It seems to me if the objective is to protect the most vulnerable, the people most at risk who could get really sick or die, then you would want to be vaccinating those older people rather than a police officer with a desk job or a 30-year-old firefighter who's in excellent physical condition. Is it the fact that you're using the AstraZeneca virus or vaccination vaccine that explain why first responders are getting vaccinated before some people in their 70s?
So there's what we know, certainly we want to reduce the risk as much as we can for those who are at the highest risk for severe disease. And so that is why we focus the mRNA vaccine in that age, in the older age group. The AstraZeneca vaccine that we received, we wanted to make sure that we were using it in those groups that are in the essential worker category and first responders. So, we had to choose a group to get it, and we felt this was an appropriate group that we could reach out to and who could get the vaccine. But, the vaccination plan was to use the mRNA vaccine for people over the age of 70, certainly, who are at higher risk for severe disease.
And just to follow up, in phase 2, school teachers are in the queue. If the AstraZeneca issue of is it appropriate for people over 65 or not isn't an issue, do school teachers get vaccinated before people in the 70 to 80-year-old bracket?
So I think we have to think about, I can't comment specifically on when people are going to get vaccinated or when things are going to get finished, but was certainly working through both groups diligently, and to make sure that we can give the vaccine to everybody. Certainly, there can be two. I guess there'll have to be two concurrent vaccine groups. The AstraZeneca vaccine, we're not getting a lot of that, so we want to make sure that we're using the mRNA vaccine in those larger groups that we want to ensure are not or at higher risk for the severe disease. So, people will get done throughout this group, but I really can't comment specifically on when one group's going to get done in relation to another.
Okay. Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, Saskatchewan is amending its OHS regulations to ensure workers can take at least 3 hours to get vaccinated and not get docked pay. Has that been done here, or are there plans to do it here?
Minister, perhaps you can comment on that. I'm not aware of any right now.
No, sorry, I was trying to Premier, but I'm fumbling with the technology today. My apologies. As far as regional health authority employees are concerned, for example, this was an issue at one stage because somehow the story got out there that they would have to take annual leave and these kind of things. That is not the case, and that they can go, if you like, on company time. So as far as the public sector employees are concerned, we're not trying to put any barriers there for them getting the vaccine. Obviously, I would encourage private employers to do the same, but have no control over that.
Okay. So I guess that's no. All right. As well, there's a lot of, there's recent talk in St. Pierre wanting to open a bubble with the province. They expect everyone to be vaccinated within 2 weeks. Is there any interest on this end of pursuing an exemption through the federal government?
With respect to St. Pierre and Miquelon?
Yes.
I've not had any discussions with my federal counterparts on the federal border there, but I'm not sure if you have with yours on a national table, Dr. Fitzgerald.
No.
So that hasn't come up just yet, but I'm sure it will.
Okay. Thank you.
Our next questions are from Danielle Edwards with the Canadian Press. Please go ahead.
Hi. Yes, I just had one more question that I wanted to ask. But what's been learned from the recent outbreak due to the variant of the virus? We know that it's more infectious, but is there any evidence that it's actually more dangerous? Seems to be a little bit of confusion about whether or not there should be more concern about variants cases of COVID-19 because it's more likely to cause serious condition of COVID-19. So I was just wondering if there's been any data out of the outbreak that would suggest there's a higher infection rate, but whether or not it's more dangerous is still, not quite yet known.
So our outbreak, and the number of cases that we had, even though it was a large outbreak for us on the whole, it's a relatively small number of cases. The UK has had a lot of experience with this virus or this variant of the virus, and certainly there have been some studies and some indications that perhaps it does cause more serious disease. The other thing we have to remember is that, excuse me, in our situation, there were a significant number of younger people who contracted the virus, and that can certainly make a difference when you're looking at the proportion of people in an outbreak who end up with severe disease. So I'm not sure that we're really the best case to use to determine disease severity. We do know that, or it appears that from what we've seen, that people ended up in hospital. Those who did end up in hospital ended up there a little bit more quickly than we saw in the previous outbreak, which was related to the original strain of the virus. But I think on the whole, I don't think we can say that we saw more severe disease in that respect. But again, we have to remember that we had a different epidemiology than the average. So it's certainly more infectious. And the thing we need to remember, though, with any of these variants is that if you're more infectious, you're going to get more people infected if there is an outbreak. And that in and of itself could mean you end up with more people in hospital and more people in ICU and more people dying as a result of infection than you would get with a virus that causes more severe disease. Because it spreads more quickly and can infect so many more people. So just because something doesn't cause more severe disease, the fact that it's more transmissible can still end up overwhelming your healthcare system.
Right. Thank you. I have no further questions.
I will now go back through each reporter to see if you have one final question. Richard Duggan with VOCM. Do you have a final question?
I do. Last fall, we set the goal of 85% vaccinations for the flu. I was just wondering if we could get an update on those numbers and how many people got vaccinated.
That's it. Oh, Janice, do you have...
No, that's fine. You go ahead.
No, the last figure I saw is now a month and a half old. So rather than quote that and probably misquote it from memory, I will go back and get you some fresh data because there has still been some flu clinics on the go.
Thank you.
Ben Cleary with NTV. Do you have a final question?
Hi there. Yeah, I just have a question back to sports. With the level of risk higher with the variants, can team sports expect not to be back until the majority of the province is vaccinated?
So we still haven't, we haven't made decisions on what's going to happen with team sports. We're asking sports associations to submit some plans for how they're going to be able to return to play safely. And I think we need to look at those really to see how things can be done safely. And, I certainly don't know all the individual sports, so I wouldn't want to presume. But we do, we do need to approach things a bit differently in order to be able to do things safely.
Thank you.
Mark Quinn with CBC. Do you have a final question?
Yes, I do. Thank you. With the target of reopening the Atlantic bubble in mid-April, do we expect that rotational workers will see the measures that they have to adhere to changing before then? Will they have more freedom before the Atlantic bubble opens?
Well, the new protocol is in place now. I don't know if you want to speak to that, Dr. Fitzgerald.
Yeah, so as of right now, they are able to, they essentially have the same protocol that they had before, except that there's a testing protocol layered on top of that. You know, at this point, certainly for those, you know, once the Atlantic bubble is reinstituted, then travel will be able to happen throughout the Atlantic bubble, and it will be people who are coming from outside of the Atlantic provinces who will have to adhere to that protocol.
Thank you.
Roger Bill with the Shoreline News. Do you have a final question?
Yes. Dr. Fitzgerald, just to go back to the question about the queues and 2 queues. I can understand there being 2 queues if you've got 2 different kinds of vaccines. One group is suitable for one kind of person and another not. But just for a moment, let's presume we don't have any AstraZeneca vaccine, and all we have is Pfizer, Moderna, and the J&J Janssen vaccine. Are there still 2 queues, or now do we just have 1 queue for people over 70 and then school teachers or other occupational groups? Or is there still going to be more than 1 queue?
So if you're just Pfizer, Moderna, and J&J, you still have 2 different types of vaccine there. So you have mRNA and viral vector vaccines. So, you know, so you would still, I think, have 2 different queues. You know, we started this with knowing that mRNA vaccines are what we would want to use in those at greatest risk for severe disease, and that's still where we stand with it. So, you know, that's why we're pursuing the strategy that we are, and our epidemiology right now allows us to do that. You know, and so I think, you know, we need to continue with that.
Okay, thank you very much.
Peter Jackson with the Telegram. Do you have a final question?
Yes, it's a little way out, but I'm getting deja vu again about tent camping. Do you think it's likely this year that people will be able to tent camp on the 24th?
On the 24th of May?
Yes.
On the 24th of May, which is more than 2 months away, I'm not going to predict at this point, Peter. I'm certainly not going to say anything I'm going to be held to or that I'm going to regret. So
We'd all like to get away, though, Peter.
Okay. Thank you.
Danielle Edwards with the Canadian Press. Do you have a final question? Okay, thank you, everyone. Premier, do you have any final comments today?
Thank you all for joining us for the end of the week update. Certainly good news as the cases continue to drop and the number of vaccines continue to increase. But it's, again, incredibly important that people be vigilant with respect to the public health measures and to follow Dr. Fitzgerald's advice. I know everyone's been patient to date, and we just need to dig a little deeper. Throughout the weekend, if you can find it in you to support local businesses, now's the time that they need your support the most. So please continue to look for safe ways to support local. But otherwise, have a good weekend and stay safe.